What does bonding mean?
Bonding is the emotional attachment that a parent forms to its newborn infant, and that is a feeling that is very, very important for the mother and the father to be able to care for their child. And that process, especially with the mother, starts immediately after the birthing process. As a matter of fact, a mother needs to be bonding with the child immediately after birth, and that's being done by, after that the infant has been born, placing the baby on mother's chest and allowing the mother to be in a position to look at the baby's face, look into the baby's eyes, allow the baby to latch on and start suckling on her breasts, to form that emotional bond that is so important for the mother-newborn relationship. As a matter of fact, if mothers are deprived of that early phase of bonding or forming this emotional attachment to their baby immediately after birth, it prolongs this process of attaching to the baby much longer if it's done later on or even several hours later.
The better the nursery that you have a kid in, the more they'll encourage bonding and presence of the mother in close contact with the baby. Is that true?
Absolutely. It is much healthier for the mother and the baby to be in a position where they are either having access to the baby all the time, or even what used to be called rooming in, when the baby is next to the mother in the room itself, where the mother can constantly be there to care for the baby, feed the baby when the baby needs to be fed, and form a very close physical contact with the baby, which will be easy if the mother is there right next, or the baby is right there next to the mother, and the baby can basically be touched and hugged and caressed and looked at the mother or by the mother on a constant basis.
If you choose an obstetrician, the first question you should ask them, what's the process after the baby is born? There's good bonding, birthing type of center or something like that, because that's part of the whole package, isn't it?
Absolutely, absolutely.
So the bigger the institution, more likely they're sensitized to that particular component. Is that right?
It's extremely important to be sensitive to these issues, and a lot of the new delivery rooms and obstetrics departments are actually developing what's called birthing suites, where the mother and the baby after birth can stay together and bond immediately after birth. Obviously the father's role in it is important as well, although it may take longer for the father to bond with the baby. But the bonding of the mother to the baby immediately after birth is extremely important.
And there's some long-term good effects from bonding too, isn't there, Earl?
Absolutely.
So in other words, the question you should ask an obstetrician, not only that he delivers well, what does the hospital deliver right afterwards?
Yes. You want to know what the whole setup is immediately after birth, and what facilities they have in order to make this transition as pleasurable and as smooth as possible.